Hello, everyone. Welcome to another episode of the Pulse podcast. Today, we are very excited to have Faramarz Farhoodi with us today. Thank you, Faramarz, for taking time and speaking to us. Faramarz had an illustrious career in technology, especially in the field of AI, and he's also the founder and CEO of AI Nexus Healthcare. Welcome, Faramarz.
Thank you, and happy to be here.
Yeah, so for Amars, there's so much that we can say about your experience and your illustrious career over the past so many years. But I think I'll introduce you as the CEO of AI Nexus Healthcare today. Why don't you tell us about what's your career been like and why did you establish AI Nexus?
Yes, be happy to. So I've been working in the general field of applications, in particular software applications, in particular AI-based applications for more than 30 years. And about 3 years ago, we decided to start our own company, and our focus is to apply AI technologies responsibly to help individuals look after themselves, um, so that they don't get ill in the first place. And if they happen to be living with chronic medical conditions, to really help them manage those conditions better. So our goal is really to enable individuals to look after themselves.
No, that's great. And I think AI Nexus is doing a great job in this space where we know that AI has a lot of potential, especially now that we see a lot of people using remote monitoring tools and the data that is being generated from these healthcare applications, remote patient monitoring. AI can really be a valuable tool in evaluating and working on that data. So, in your opinion, Faramars, what are the most promising application of AI in healthcare today?
Well, I think from a practical point of view, I would categorize the applications into two broad categories. One category is really for the consumer, for the individual, to really help them live healthier, longer lives. The other category is clinical, and that's really more for the clinicians, which really would have much tougher regulatory requirements to abide by, and generally would be targeting improving clinical outcomes and improving the efficiency uh, of delivery of care and lowering costs. And pretty much in every country on the planet, there are problems with shortages of doctors, medical facilities, access, affordability. So, each of these areas or each of these categories would have their own benefits in terms of reducing the inflow to hospitals and doctors, by focusing on the consumer side or the individual side. But of course, once people actually do need to go and see doctors and go to hospitals and so on, improving the quality of outcomes and making the whole process efficient is going to be beneficial to everyone.
No, absolutely. And what I mean, we've seen that AI has really changed a lot of other industries, and I think we hear this a lot that why is there why isn't healthcare adopting it as quickly as other industries have. And you're in this space, and I know you've been working in many different countries. Your platform and your vision is very inclusive. So, in your experience, why do we see a slow adoption of AI driven technologies in the healthcare space? What are the main drivers of the slow adoptions, of apprehensions that you've seen in your experience?
Well, I think some of it is arising out of the, if you like, the suspicions and apprehensions about AI, arising out of movies like Terminator, and if you like sci-fi movies, where AI is trying to take over the world, and so people have some kind of a apprehension of artificial intelligence as a technology, but also there is a healthy, I believe, and valid concern that artificial intelligence could be misused.
True.
And the misuse could be either people trusting, uh, if you like, inaccurate advice, or advice that hasn't been validated or medically, if you like, validated. But also, frankly, violation of privacy and intrusion into people's private lives. Uh, but also, frankly, AI is a word that people use all over the place, and people are confused as to what it is and how powerful it is or how basic it is. So there's a cloud of confusion and concern. Some of it is valid, and some of it is really based on inadequate information. The responsibility of our people like myself, who are in the technology, is to really make it transparent and understandable that AI is just another tool. It's just like when computers first came out and applications came out. People were suspicious that computers were going to take over the world, all over the world. But uh, it's just a question of responsibility on people like myself to make sure people understand it's just yet another tool. It's just another tool, and it could be misapplied or it could be applied properly. If it's applied properly, it could actually help improve the quality of life for people. But if it's misapplied, it could be harmful, just like any other piece of software, like malware on your computer. That could be harmful to everything that you do.
So that's also that people are really, healthcare information is sensitive, and as you said, people don't trust it, and if they don't trust it, they really don't want to share their information with people because they don't know in whose hands it's going to go. There's also a lot of debate about whose data it is that we're actually, gathering from these remote monitoring tools. So definitely there is a lack of trust, there is a lack of, I think, guidelines, there's a lack of um, frameworks of data sharing, of
Mhm.
interoperability. And I think, but this is across both sides, I feel. I mean, I'm sure you see it in the doctors as well, but in amongst the users as well, the main consumers that you have in AI in healthcare. Both have different sets of apprehensions. I think the doctors themselves are also scared because they don't know enough. I think we're not teaching them enough. And I completely agree with you that it is a responsibility of people like us to tell people what exactly it is. Because again, AI is such a broad term. It encompasses so many different solutions and so many different technologies and models that could be used and could have a really positive outcome. So, how important do you think AI is? And I know AI Nexus really talks about democratizing healthcare. And what role do you see AI playing in really making healthcare more accessible and more inclusive?
But actually, let's start from uh, the current applications. Taking the consumer side now, there are like more than 300,000 apps on app stores, um, all talking about some aspect of your wellness and health. Everything from diet to menstruation cycle tracking to diabetes tracking and so on. So, but all of these apps are pretty much focusing, or the majority of them by far, are focusing on giving people data. And then it leaves the actual interpretation of the data to
Hmm.
the individual.
True.
Because the only people who are really qualified to interpret wellness and health data are professionals in the field, in particular medical doctors. And of course, there's such a shortage of medical doctors even to treat acute problems. Bringing that kind of expertise forward to help people actually not get sick in the first place, or stay healthy, is a big challenge. But technologically, many of these companies do not know how to do that because it requires a particular combination of AI technologies and frankly, the involvement of medical and wellness specialists to collaborate to create the kind of technologies that could actually do the interpretation of the data and give individual advice to every person, because we're all different, and we go through different stages of life. If a woman happens to be pregnant, there are certain medical concerns that come up that would not normally come up if the person was not pregnant. As men go through different stages of their lives. They have different medical conditions that they're more amenable to. So what you need is the ability to interpret data and help individuals really understand what's going on with their bodies, what's normal, what's abnormal, and really help them on a daily basis in an easy to use and easy to access fashion, irrespective of means to pay and irrespective of culture, language, and so on. Now that's a pretty big challenge, or
True.
really very challenging. So unfortunately, the majority of the companies who talk about AI are using a particular type of AI, which is machine learning based and really works with data, very useful, comes up with some patterns, but interpretation is lacking. So what you need is more complex types of AI, which not many people are actually experienced or knowledgeable about, which really codify medical expertise, and that medical expertise can then interpret the data and adapt it for every individual. So, and that's the kind of area that we're focused on, because my professional life in AI has been really focused mostly on basically capturing and deploying human expertise in a machine to, if you like, make the machine smarter, not because it grew by itself to be smarter, because it was injected with human ability to interpret
To
information.
be
So
smarter.
combining the two types of AI is something that not many companies can do. Until that is done, and if you like, made accessible to everyone, the full potential of AI is not going to be realized for the individual. Now, for clinical applications, it's very different, because for medical people, you really need some kind of a decision support tool. You don't need to explain what a disease is, what symptoms are. You just need to help them have, if you like, a second pair of eyes, looking at the results, and based on data or based on analytics to actually support, clinical decision making. So the two sides are very different in terms of how you would approach it. But frankly, I believe that focusing on the individual is going to be paying the most dividend, because if people don't get sick in the first place, doctors are not going to have a lot to deal with. Why don't you focus on, if you like, slowing down the inflow, and then medical people would have more time and better quality of time to spend with people who they do have to deal with. So I think focusing on the consumers and helping them not get sick in the first place is a more, if you like, immediately dividend paying kind of area to focus on.
No, absolutely. And especially as you said, I mean, we are in this crisis where we don't have enough healthcare workers. There's a gap in supply and demand, and and it's important that the people who really need help do get the help that they need at the right time. I think time is also so important in clinical settings, because when we have less healthcare HCPs, they have less time on their hands. They probably don't are not able to see as many patients as they should be seeing. So definitely AI can be very effective there. And also in clinical decision making as well. And especially we see it's being used a lot in radiology, because it has the ability to just look at images at a much faster pace compared to a human. So
A much higher resolution as well, because the computer can analyze images at a pixel level.
mhm.
Where the human eye doesn't just have the resolution to look at such details. So absolutely.
Oh, absolutely. So, where do you think the healthcare organization, healthcare leaders, and doctors can help this, AI revolution in healthcare? How can they embrace technology? How can they make full use of this tool to make their lives easier, the clinical settings more efficient, with less errors, and overall improve the healthcare delivery system.
Well, I think it would need to start with having an open mind and not having prejudices and preconceptions uh, that would inhibit a rational examination of evidence and uh, if you like, evidence-based, you know, approach to healthcare. I think it's good for, it's very important for the medical community to remain skeptical and, if you like, have a prove proof first, before adoption. That's actually quite healthy. But what I have experienced in my limited exposure, and this is feedback that I've received from our own medical team, and we have a team of 27 world-class specialists in different areas advising us, is that the medical community, because first of all they're so busy dealing with acute problems and so on, general practitioners in particular have very little time to even keep up with their own uh, areas of concern, like staying up to date with the field of medicine, let alone actually getting used to new technologies like AI. And patients, who tend to use Dr. Google, turning up, at the practice with, hey, I Googled X and, this is my medical condition. It's not making the job easier. And frankly, it makes them even more reticent. However, I think the specialists, coming out of the general practitioners who do actually focus on the latest and the best, in their individual fields and try and keep up. I think they could take a leading role through professional medical associations to really establish protocols and standards and frankly studies to lead the exploration of AI
Too.
in clinical assessment. Now there is some sporadic work going on here and there, different institutions, but some kind of a cohesive and integrated approach is missing. I think that would really help improve the quality and focus of work in the field of artificial intelligence and medicine or healthcare and wellness. But it would also help, dispel some of the myths, if you like,
Mm,
of what is good or bad about AI, and it would help companies stay, if you like, on a straight and narrow and not deliver solutions that are really flimsy or mislabeled and AI for this and AI for that, whereas there is very little intelligence and utility in what they're doing. So it's good for everyone, for the medical community to take a leadership role and not to leave it to technologists and
absolutely.
the hubris who feel they can actually get everything done with data to lead the way.
True. And I think, I mean, you've been in technology, I mean, for decades, and before this, I think even before pre-COVID, it's much more talked about now. Technology was being developed by just technology people.
Yes.
They, and especially even in healthcare across all industries. But now we hear about terms like co-design, get clinicians on board, and I think you. AI Nexus has done a lot of work in that because you have a lot of clinician leaders on board, because that's, I think, where the difference is. You need to understand what really needs to be done. Why are you using this technology? What's the end goal? And I think a lot of the platforms and solutions that we see now, as you said, there are so many of them, a lot of them have missed the mark, as in what will a doctor get out of this, or what will a patient get out of this, because they've designed those technologies from a completely different point of view. So I think this co-design technology with clinicians and with patients and all the stakeholders is so important.
Oh, absolutely. And also, like, as for example, our goal in helping people stay healthy is, but also as soon as, we're focusing with our medical team to capture the early warning aspects of their expertise. We're
Hmm.
not trying to replace doctors. We're simply trying to capture the elements of their expertise, whether it's cardiology, neurology, or what have you. How do you detect that someone is experiencing what could be potentially serious? or they're basically the onset of chronic disease, because of our lifestyle and so on. And really, first of all, give advice to people where it's appropriate and preventative, like improving your sleep, including reducing your weight and things of that sort. But also when to see a doctor sooner rather than later, because as as a medical doctor, many medical conditions, if caught early, can be dealt with a lot more quickly and, if you like, cost effectively for everyone concerned. But as time develops, silent diseases like hypertension, leading to cardiac issues and heart attacks and so on, and your weight and diabetes, increasing the risk of stroke. All of these things could be really prevented, as 80% of chronic diseases are preventable. And so how we create an early warning system for people, but not to scare people, just giving them advice, education, and so on, contextual, and really help them know what they can do and when they need to see a physician. Is
True.
really, I mean, it's simple as a problem to express, but addressing it is going to be complex. And as you said, involving medical specialists at the earliest stages is critical, because technologies like myself, who may be idealistic about what technology can or cannot do, or should not do, have really no idea what actually matters until you talk to an expert. It could be in a financial area, it could be in medicine, it could be in any area. Human experts need to be involved right from the beginning, and they need to develop, if you like, they need to lead the specification of solutions to problems, because then we can actually have a better chance of developing something that's useful, and not just to try and make money from things that are really not very useful and potentially, frankly, dangerous when
True.
it comes to medicine and wellness.
And I think both can be done easily together. I mean, I know a
Absolutely,
lot of companies, technology companies, are trying to do good, and yes, they want to be profitable. But you can do both the things together. You
absolutely,
could be profitable, but
absolutely.
you could have a good team, have clinicians, and have applications that are actually making the life of the consumer better, be it
Absolutely.
cost of care, accessibility, inclusivity, ease of use. I find ease of use to be such a big pain point for so many
Absolutely.
doctors and so many patients, because a lot of technology out there is very complicated.
That's right.
Yeah.
That's right. Devices. I mean, if you take these wonderful devices that I wear quite a few of them, working around like a Christmas tree, and these wonderful devices provide so much data. And you know, when I sort of started using the very first devices that came out, it took really months to actually learn what any of this data actually means and how to use it on a daily basis. And I'm a technologist, and I'm actually, if you like, I geek out in these areas. For most people, and I know, again, a small sample, pretty much dozens of people who, for example, buy these smart watches, and with the hope of the device helping them, learn more about their health. But pretty much a few weeks into it, the device ends up to be just a smartwatch, and they use it for time and maybe some alerts on their
That's
watches and so on. Because frankly, the it's hard to know. Hang on a minute, I'm getting my heart rate second by seconds. How does that translate into, am I healthy? Am I not healthy?
true.
Generally women's and men's resting heart rates are different. If you have medical conditions, if you have if you're pregnant, if you're taking medication, all of these things affect what is happening to you. None of these devices are sensitive to that. To give you a very simple example, I won't mention the device, but it's very popular.
Hmm.
And so I have this device, happens to be a ring, and I define my profile that I'm a male. Here's my age, here's my gender, and out of curiosity, I subscribe to its menstruation cycle warning, and
Okay.
it gives me menstruation cycle warnings every month. And this is supposed to be a pretty expensive and sophisticated device, yet it doesn't use my gender
To
to
know.
know that I should not be given menstruation cycle warnings. because they're using the data for marketing purposes and not for medical purposes. And the ranges for heart rate and so on are not calibrated to the person's age and those medical conditions. So anyway, that's just an example of how
No, no,
a of what,
that is so important because see, if we say, like people like us, we say we want to change healthcare or make a small difference. Obviously, we can't change, but make a small difference, push the envelope a little.
right.
We will have to do things right, right?
That's right. That's
Anyways, people are so skeptical that oh, AI is going to replace doctors, or we we have to do better so people trust these technologies more. And I think the customer experience is the most important thing. Like how many times we buy things and we never use them because we just think, oh, you know what, it's of no use to me.
that's right.
So yeah, thank you so much. I can't believe it's already, we've been talking for 25 minutes. But my last question for Amars,
Mm.
um, where do you see, as a technologist and working in healthcare, where do you see healthcare in the next 10 years?
Oh, so being a sort of a Star Trek fan, being a Trekkie, I believe that you know, within the next even 5 years, there's going to be a revolution in really smart devices for the home and applications for the home, including on your TV and available on your TV, and really consumer devices that you use every day. Even smart, already there are smart mattresses, there are already smart things that monitor your movement and so on. I believe there's going to be a revolution in helping people really get get a much better handle on the lifestyle and how to stay healthier. But I think on the clinical side, I see an absolute revolution in diagnostic tools that would help the medical professionals to diagnose disease and to improve outcomes. But all integrated together, like people being able to walk into the doctor's office and the doctor's systems, or the medical systems, already knowing a lot about them, and through the individuals basically providing access and permissions and so on. So I'm really envisaging an integrated, intelligent web of connectivity. Uh, but it all really comes down to trust and also the ability of regulatory bodies to make sure that abuse is basically made difficult, if not completely inhibited. There's always a possibility of breaches and so on. I think once trust and necessary protocols are in place, uh, I see a bright future of healthier, people being healthier and making it easy for people to be healthier, and also relieving pressure on medical services. If we all participate and play our roles with an open mind and a good heart.
Absolutely. Thank you so much for Amars. And I think really future is exciting. And as you said,
Mm.
I hope all of us are able to build more trust, make these technologies more accessible. And I think as the technologies will grow, more work will be done. They will become cheaper as well. Because right now, I think a lot of these cool gadgets are just catering to one portion of the population. But I hope in the future we see more and more that are targeting all segments of the population. So
Absolutely, and I think your smartphone and is going to be really playing a big role in that, because it's the most ubiquitous device on the
true.
planet, and focusing on building things that people can access, regardless of ability to pay, and respecting cultural
Absolutely.
and also ethnic differences is going to be critical. So everybody can have access, and there'll be, if you like, a democratization of access, and not
Absolutely.
just for the elite who can afford these expensive gadgets right now, as you said.
No, absolutely. Thank you so much again,
Pleasure.
Faramarz, for taking time out of your busy schedule. It was a pleasure to have you on the
And
podcast. Thank
thank
you
you.
everyone who listened. And please subscribe to our page and stay tuned. Thank you very much. Bye bye.
Thank you. Take care. Bye bye.